Obsessive Compulsive Disorder, OCD. Many of us have small habits that make us feel better, but we can also live without them. For example, we might think of something as lucky or have a routine that feels comforting, but for people who experience obsessive compulsive disorder, OCD, these behaviors are much more intense and disruptive, and are fueled by unwanted thoughts that don't go away. Obsessive compulsive disorder is not always easy to understand, but it's a real illness that causes difficulties in a person's life. So what exactly is OCD? Obsessive compulsive disorder is a mental illness. It's made up of two parts, obsessions and compulsions. People may experience obsessions, compulsions, or both, and they cause a lot of distress. Let's look at obsessions first. Obsessions are unwanted and repetitive thoughts, urges or images that don't go away. For example, someone might worry about making people they love sick by bringing in germs. Obsessions can focus on anything. These obsessive thoughts can be uncomfortable and can cause a great deal of anxiety. It's important to note that obsessions aren't thoughts that a person would normally focus on, and they are not about a person's character. They are symptoms of an illness. Compulsions. Compulsions are actions meant to reduce anxiety caused by obsessions. Compulsions may be behaviors like washing, cleaning, or ordering things in a certain way. Other actions are not obvious to others. For example, some people may count things or repeat phrases in their mind. Some people describe it as a feeling like they have to do something until it feels right. Who does it affect, and can it be treated? OCD can affect anyone. Researchers don't know exactly what causes OCD, but there are likely many different factors involved, such as family history, biology, and life experiences. Many people describe OCD as something that takes over their life, and this is not easy to deal with. People who experience OCD usually know that the obsessions and compulsions don't make sense, but they still feel like they can't control them. Obsessions and compulsions can also change over time, but the good news is that OCD is treatable, and it's important to talk to a healthcare professional. There are two main types of treatment that are used to help manage someone who is diagnosed with OCD, one being medication, and the other is counseling and supporting someone with OCD. A type of therapy called cognitive behavioral therapy, or CBT, is shown to be effective for helping people with OCD and teaches them skills like solving problems and relaxation. For OCD, therapy may also include a strategy called exposure and response prevention, which helps you learn new ways to look at obsessions and compulsions. Antidepressants are the most common medications used to reduce OCD symptoms. Antidepressants often require higher daily doses in the treatment of OCD than of depression and may take 8 to 12 weeks to start working, but some patients experience more rapid improvement. Knowing that your brain is lying to you while not being able to resist its commands can be agonizing. But with knowledge and understanding comes the power to seek help, and future research into the brain may finally provide the answers we are looking for.